Dr. Chris, and today I am reacting to the Eli Tomac Thunder Valley crash. Generally, it is not a good idea to crash off a motocross bike onto your outstretched hands. Eli Tomac, professional motocross rider, and his 2015 shoulder injuries are going to help us to understand why.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you're here because you subscribed after watching my video on Ken Roxon, then thank you for becoming a part of the intern army. Welcome to my channel, where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. If you're interested in sports injuries, how they happen, and how they will affect your favorite athletes, then this is the channel for you. Today, I'm talking about Eli Tomac and the injury that he sustained on May 30th of 2015 at the Thunder Valley outdoor event. At the time of the injury, this was the 6th event of the 2015 Lucas Oil Pro Motocross Series. Eli Tomac had already dominated the preceding 5 events, and this event was no different. As was his habit, Eli was leading the race in a commanding fashion when the unthinkable happened. Eli lost the rear end and was catapulted from the bike onto the track surface. When we look at the replay, we can see that the rear end of the bike swung around to Eli's left-hand side before being caught on a rut and throwing him headfirst to the ground. On a road course, high sides are always the worst type of crash, and on this dirt track, it was not any different. It was all Eli could do to throw his hands out in front of himself to offer his head and neck some sort of protection as he became a freaking lawn dart. He struck the ground chest first with his arms outstretched overhead. Fortunately, he was not knocked unconscious. He was able to walk off the track under his own power, always a good sign. But he was clearly favoring his left arm. No wait, his right arm. Scratch that. He was favoring both arms. Here, Eli had managed to injure both shoulders simultaneously in this off. Considering what other injuries might have occurred from his headfirst flight into the dirt, he was rather lucky getting off as easy as he did. So what exactly happened to Eli in this collision? What are the injuries that he suffered? How were his injuries treated? And what did these injuries mean for Eli's career moving forward into the future? Based on the manner in which he fell to the ground with both arms held in forward elevation and external rotation, we could expect that he might have suffered dislocations of his shoulders. This arm position is the hallmark position for anterior dislocations of the shoulder. These are shoulder dislocations where the ball of the shoulder, the humeral head, is forced out of the front of the shoulder joint. In fact, that is the injury that Eli suffered, but only on his right side. As expected, Eli suffered an anterior dislocation of his right shoulder when his impact with the ground forced his right shoulder into external rotation with respect to the body itself. This injury is usually associated with a labral injury as well. The labrum is a structure that runs around the shoulder socket, or glenoid. During a shoulder dislocation, the humeral head knocks the labrum off the front edge of the glenoid. Usually, only the labrum is involved, but on occasion, a piece of bone can also be knocked off the front of the glenoid as well. So this explains the right shoulder injury. While his right shoulder was put back into place by the Asterix medical team on scene, the damage was already done. More on that later. But remember, Eli injured both of his shoulders in this accident. So if he only dislocated his right shoulder, what did he do to his left shoulder? Well, believe it or not, the shoulder dislocation was the less serious of the two injuries. On his left side, Eli suffered an injury that is not commonly seen in young patients. Here, he suffered a rotator cuff tear of his left shoulder. The rotator cuff is a group of 4 small muscles that lay just outside of the shoulder joint, underneath the larger shoulder muscles such as the deltoids. The rotator cuff muscles help to initiate movement and to control fine motor movements of the arm. Each muscle is responsible for a different movement. A tear in one or more of these muscles will have effects on one's ability to move the affected arm in space. The specific pattern of lost function will depend on which of the 4 muscles has been injured and how severely. The functional deficit will determine whether or not surgery is required for treatment. Speaking of which, how were these injuries treated and why? Both of Eli's injuries were treated surgically in a staged fashion. The rotator cuff injury to the left shoulder was deemed the more severe injury, so it was addressed first. As was true of Ken Roxon after his injuries in 2017 and 2018, Eli was treated by surgeons at the Steadman Hockman's Clinic in Vail, Colorado. He underwent a rotator cuff repair initially. Given the urgency with which he was treated, I would assume that his tear was large and involved, at the very least, the main rotator cuff muscle, the supraspinatus. However, given the mechanism of injury, I would suspect that the subscapularis was also likely involved. When the tendons are repaired, they are sewed back to their bony attachment on the humeral head using suture anchors. After this surgery, a post in UltimateMotorcycling.com reported that doctors had successfully repaired the damaged tendons in his left shoulder, confirming that at least 2 tendons were repaired. Surgical repair of the left shoulder was necessary to avoid functional deficits and motor weakness in arm movements controlled by the rotator cuff, including forward elevation, internal and external rotation. These functional deficits would make it difficult to adequately control the bike using his left arm. Not safe for a world-class professional motocross racer. So, what about the right shoulder? Eli was scheduled for surgery on the right shoulder 2 weeks after his left shoulder was operated on. He underwent a labral repair where the detached labrum is sewn back to the anterior or the front aspect of the glenoid from where it was detached. While not every shoulder dislocation requires surgery, it is generally true that young active males who have one shoulder dislocation will continue to have shoulder dislocations until they are no longer active or they have had their shoulder surgically repaired. Given the nature of Eli's chosen occupation, it is safe to say that without surgery, he would be looking at a natural history of recurrent shoulder dislocations whenever his arm moved into an at-risk position. There are plenty of these in professional motocross racing, so he had it fixed as well. Smart move. Following his surgeries, Eli was sidelined for the remainder of the 2015 motocross season. He returned to Supercross January 9th, 2016 at the Anaheim 1 race where he finished 4th. Since returning to Supercross, he has missed only a single race due to injury and has finished no lower than 3rd in the overall standings. As of the filming of this video, he is currently in 1st place with 384 points, leading his closest rivals Cooper Webb and Ken Roxon by 25 and 30 points respectively. If you were worried about Eli's double-barreled shoulder injury, worry no more. I think that his performance means that his shoulders are working just fine. If you want to be part of the team that helps with the preparation of videos and the selection of topics, you can support what I do by joining me on my Patreon page, where you will have access to additional content and you will be able to interact with me more closely. If you enjoy podcasts and you haven't already, be sure to subscribe to my new podcast channel. The link will be down in the description below. And if you want information on exercises and workouts, or you want more information on injury prevention, be sure to check us out on our sister channel on YouTube, Human 2.0. Thanks for watching. I appreciate your attention. And as always, that's been a word from Dr. Chris, not your everyday ortho.